How is rabies diagnosed in cats? Have you ever wondered how veterinarians determine if a cat has rabies? This is a vital question, especially when it comes to protecting our furry friends. Rabies is a serious disease, and diagnosing it is not as straightforward as you might think. First, it is important to know that clinical signs alone cannot confirm rabies in cats. Symptoms like sudden aggression, paralysis, or difficulty swallowing can appear, but these can also indicate other illnesses. This overlap makes it tricky for veterinarians to make a diagnosis based solely on what they see. The only way to definitively diagnose rabies is through laboratory testing of brain tissue. This process requires euthanasia and a post-mortem examination, which is understandably a difficult decision for pet owners. The preferred areas of the brain for testing include the brainstem, cerebellum, thalamus, pons, and medulla. There are a few laboratory methods that are considered the gold standards for diagnosing rabies. The direct fluorescent antibody test is the most widely used. In this test, brain tissue smears are stained with fluorescently labeled antibodies that specifically bind to rabies virus antigens. When viewed under a fluorescence microscope, infected tissues will show bright staining, confirming the presence of the virus. This test is known for its high sensitivity and specificity, providing results within hours. Another method is the direct rapid immunohistochemistry test. This test uses antibodies with chromogenic markers to detect rabies antigens in brain tissue. It is also reliable and can be performed in various laboratory settings. Molecular techniques, like reverse transcriptase polymerase chain reaction, can detect rabies viral RNA in brain or other tissues. This method is accurate and can differentiate between wild-type and vaccine strains of the virus. Handling samples carefully is crucial to avoid contamination. They must be shipped under proper conditions, usually refrigerated or preserved in a glycerol phosphate buffered solution, to maintain the integrity of the virus. From a veterinarian's perspective, prevention through core vaccination is essential. This is because diagnosing rabies requires euthanasia and laboratory confirmation. If a cat is suspected of having rabies due to exposure or symptoms, immediate isolation and consultation with public health authorities are necessary. Vaccination remains the best way to reduce the risk of rabies in cats, ensuring they stay healthy and safe.